Hello, I'm Mehrnaz Campbell, founder and CEO of Kimia and author of The Omni Advantage. Welcome to our LinkedIn Live series in March. I'm really, really excited that you're here. At Kimia, my purpose is to unleash the human potential to create a healthier world. And I do this by inspiring pharma leaders to shift from just being message bearers to becoming trusted advisors for healthcare professionals. And over the last 3 years, we've tackled the challenges of digital transformation in healthcare. And through these series, I want to spark connections, inspire change, and drive meaningful transformation that really improves outcome for healthcare professionals and ultimately their patients. I'm really passionate about helping pharma professionals feel confident using technology to improve our engagement. And that's why I've been interviewing inspiring leaders to learn from them and also give them a platform so we can all benefit from their insights. So today I'm really thrilled to welcome Andrew Binns, who until recently was a head of digital and innovation at AstraZeneca. Hi, Andrew. It's really great to have you here.
It's lovely to be here. Thank you very much for the invite. I'm in central London, so apologies if you hear police sirens or motorbikes.
Well, is it less or more police sirens compared to Liverpool? That's what I want to know, Andrew.
Yeah, a lot more in London. Liverpool's the city of culture now, Mehrnaz. Did you know that?
No, I didn't, but I think it's a beautiful city. I've been there. I think I was there for a conference and I stayed in the hotel where they've got the, legacy of the Beatles, which is beautiful. Yeah. So Andrew, you've this is like breaking news. You've got moving from AstraZeneca, and you're going to be the global marketing director at Croda Pharmaceuticals from next week, right?
Yeah. So super excited to start a global role, working for an amazing company who are doing fantastic things. Had the best 4 years of my life at AstraZeneca, absolutely, without a shadow of a doubt, the best job I've ever had. Never made so much impact working with so many talented people in an industry that was really open to quite disruptive thinking and very open to trying different things without that fear of failure. I had, some wonderful work colleagues there, and I'm thrilled that still going from strength to strength with the evolution of omni-channel from just a buzzword into a full scoped out customer engagement plan. So yeah, it's been really good fun. So, but looking forward to a global role, hopefully with a bit more travel.
Yeah, well, that's really exciting. And I think you've made your mark there. I'm so glad you decided to join the pharma industry. And, I'm really excited about asking you questions and tapping into your expertise. But before we dive into asking the questions, I wanted to tell everybody a little bit about Andrew in case they don't know you. So Andrew Binns began his marketing career working for English Premier League football clubs and major tourist boards, including Visit Britain and Visit California. And I think in these roles, Andrew developed a deep understanding of the customers and audiences' mindset and behaviors, and recognizing that power of strategic engagement. And to build on this foundation, he also trained as a COM-B, the behavior change framework, and later became a BJ Fogg-accredited practitioner, refining his expertise in driving that meaningful behavior shifts. And, we're going to talk about it a little bit more, but just to give you an insight is, he studied specifically why would French want to come to UK versus why would Scandinavians would want to come and visit the UK, and the reasons and then the underlying motivations were completely different. And I found that, curiously, Scandinavians love British food, and that's why they come to UK, which puzzles me. So clearly French wouldn't be enticed to come to UK because of our food, right? So Andrew's ability to engage audiences in innovative and creative ways really caught the attention of pharma industry, leading to his recruitment with a kind of a clear mission to disrupt the status quo and drive real change. And that's exactly what he's done in the last 4 years. And during his time with AstraZeneca, he challenged conventional thinking. He tore up the unrealistic omnichannel theories and replaced them with a pragmatic, real-world customer engagement strategies. And the impact has been immediate and significantly increasing the HCP engagement. And when we were chatting last week with Andrew, just to prepare for this, I realized that we both have something in common, and that is neither of us have a fear about asking questions. And in fact, both of us believe that there's no stupid question. Right, Andrew?
Yeah, I think one of the things I learned in Pharma very quickly was if you don't ask questions, then you're just going to sit there and not understand things. Even today, I still learn things. I still am asking questions constantly because it's such a complicated, diverse industry that we work in, where you've got people who are incredibly intelligent and you've got incredibly talented marketeers and wonderful salespeople and brilliant legal minds and fantastic compliance people, with regulation at the heart of what they do. So with that sort of mismatch of different personalities and different people, you're never ever going to be the cleverest person in the room, and you're certainly not going to be the person who knows everything. So I think I quickly learned to ask questions, which I guess as a marketeer is our job anyway, right? You've always got to be curious, you've always got to be challenging, you've always got to be trying to understand and gain insights. But I can't think of a better example of this sector than just being honest and saying, putting your hand up and saying, do you know what, can someone explain to me what that means? And I've never ever been accused to my face of being stupid or asking a silly question. So yeah, that's one of the beautiful things of Pharma. We all accept the fact that there's other people who know things that we don't know, and there's no shame in that, is there?
No, not at all. And I love that about you, Andrew. And I think I was brought up in a different culture where asking questions, having a debate was encouraged. And when I moved to UK, I guess I didn't know what the normal behavior is here. I just kept asking questions. And I remember my English wasn't that great because it's my second language. And I was training in a nursing school, and I was constantly asking questions. And my friend often used to come to me and say, we didn't know that either. We're so glad you asked, because we were thinking what we were too embarrassed to ask. So I would encourage you today, as you're listening, ask any questions. I believe no question is stupid, but not knowing is. So if there's something you're curious about, pop in the question, and then I would bring your question to the table so Andrew can look into it, and between us answering it. And I think that for me, that curiosity of a child, that they have no fear and ask questions, is so refreshing. And I think we need more of that in today's world when we're going through so much change, right?
Yeah, I think one of the scariest things for me in coming into Pharma from non-Pharma was this impression that I had, that you had to be a scientist, that you had to understand the science behind the products. But of course, there's incredibly talented people whose job is to know all of that, whose job is to communicate the scientific narrative. And what I love about Pharma is they wanted to bring people in who could sell the story well, who could tell the narrative, who were storytellers. And I think that's where Pharma should get a lot of credit, about the fact that it's acknowledging that a more contextualized message to its audience types is what's needed. No longer can we just dump 100 slide decks on our HCP customers and expect them to A, understand it, and B, have the propensity to even read it. Remember one time I was in a meeting with the fantastic colleagues I had in the compliance team, and we were talking about quite a provocative video that we were trying to get signed off. And I was slightly terrified about showing them the storyboards. And they said, you know what, this is so refreshing. They said, we're bored of approving 100 slide decks. So imagine how our customers feel. And that really resonated with me, that why do we keep doing what we've done time after time after time? How you engage with people outside of Pharma has evolved beautifully and brilliantly. So let's evolve things in Pharma in the same way.
Definitely. So we've got here Denise joining us from Canada. Hi, Denise. It's good to have you here. We've got Mark who congratulating you, Andrew, for your new position. So that's fantastic. And Jonathan, hi, Jonathan. It's good that you're joining us. I think Jonathan's based in upstate New York in US. So, and he agrees with you and I. He thinks that we need to be bold and just ask the questions and not be shy. So, hey, Jonathan, I'm counting on you asking us questions during this conversation. So, usually when I have our guests on the LinkedIn Live, Andrew, I like to reflect back to see how we first met. And I was trying to think, when was the first time you and I met? And I think, if I think correctly, I first met you online. It was just debates either on LinkedIn or various webinars that we attended. But the first time I saw you in person was last year at PM Society Awards when you won the Marketeer of the Year. And I think in 24, I bumped into you at Reuters. We both were presenting at Reuters London. And I think your presentation was just before our presentation. So we kind of like passed each other. And I saw you a few weeks ago again in London for the PM Society. What do you recall? Is that what your recollection is from when we met?
Yeah, I definitely think I remember meeting you at the PM Awards. I think it was a strange evening because to be awarded Marketeer of the Year, like I genuinely think it's, of all the awards that I've been lucky enough to win, that was the one for me, because you have a massive imposter syndrome. I still do, working in pharma, and to almost have some of the stuff that we were doing validated by judges and peers who pick you for the work you're doing rather than who you are or who you know. That was a really great moment for me. And then I think we also spoke after a couple of times I presented in Barcelona and at the next conferences as well, because I suppose whether it's a positive or negative, because of my slight newness to pharma, that naivety or the ability to ask questions without fear allowed me to do talks where I could question things like, why do we have promotional content and medical content with different strategies? Why is digital undervalued and underreported on? Why is creativity not seen as important as scientific messaging? So all of those questions that I think is brilliant that other people are asking now and farmers responding to really well. Was where me and you connected.
Mm-hmm. I think one thing really like I loved when I first kind of like saw your posts and like conversations online was I think it was a conversation you were having with Paul Sims that you were kind of like saying, no, we are selling. Like marketing is about selling, we shouldn't be shy about just telling what we're here to do. And I love that because I thought we're not just here to educate, we are educating, but at the end of the day, we want patients to have access to medicines, full stop. And the way to do it is just inform, educate, and just sell. So I love the fact that you were just calling it as it was. And that really resonated with me.
I think one of my absolute heroes is David Ogilvy, and his whole premise around marketing was along the lines of we sell or else. And I love that because that's how every marketeer should think. What am I doing that's going to make an impact? What am I doing that's going to change behavior? What am I going to do that's going to shift an attitude? And you're totally right, Mehrnaz, around the fact that Pharma's job is to ensure that products get into patients' hands as quickly and as efficiently as we can. But my job is to ensure, or was my job was to ensure that it was AstraZeneca's drugs. And I had no shame in the fact that it was my job to support my wonderful colleagues in making sure that AZ got as much of its products out there. And if that meant educating or prompting or nudging or empowering, whatever word you want to say, it was compliantly influencing our customers. And there's no shame in that whatsoever. And if marketing isn't doing that, then what's the point of it?
Exactly. Like marketing and sales goes hand in hand. We're on the same side. And, I think
marketing and sales, especially in pharma, should be the best of friends. And I still find it so strange that they're not at times, because salespeople shouldn't be afraid that marketing's trying to replace the incredible work they do. And marketeers shouldn't be snobby enough to think that the sales team don't have a place in today's environment, because absolutely they do. That personal relationship they have with our customers can never be replicated by the most powerful of digital assets or strategies. But I think I think is we are living in a larger ecosystem of engagement. So it's incredibly difficult to allocate one particular asset or event or moment that has persuaded a HCP to prescribe our drugs. And I think that's a big challenge for pharma, is how you report on the success of any marketing or sales activity if all you want to do is report on prescribing behaviour. Because how do you identify when a HCP made that decision to switch from a GSK drug to an AstraZeneca drug? It's impossible to do, because it's not like they've seen a banner advert and thought, do you know what, I really like that banner advert, I'm going to change drugs. There's so much decision making involved that sits completely autonomous to marketing. And I also think marketing, one of the things we need to accept in pharma is that I think 80% of prescribing behaviour occurs completely independent of anything anyone does. So let's focus in on that 20% of people who potentially can be converted over when they've either apathetic to our brand, or the bias against it, or the loyal to another one. They're the ones that proper marketeers should be going for.
Yeah, and I completely agree with you. I think at the end of the day, our decisions to purchase something is based on our experience with that brand or experience with that company. And it's not just one touch point, there's a combination of touch points that either delights you or makes you think, I'm not going to go there, nowhere near that. And I think I feel marketing, medical, supplies, everybody is all part of the same team, and we need to work closely together. But we can go and explore that. I'm just going to say a quick hello to Caro. It's really good that you've joined us. I'm really counting on you to ask questions. And I think I've got a few questions, as you know, Andrew. But this is just not about me. This is a live event. So it's so much more fun and engaging if we have questions from our audience. So I think with Andrew's experience in marketing and human connection, and also his expertise in terms of behavioral modeling, is a chance for you to ask him questions. So I would encourage you to pop your questions in the chat. Again, no question is a stupid question. And if you enjoy hearing what Andrew says and agree with him, give him a thumbs up and make a comment. But more importantly, if you disagree with Andrew, I would encourage you to make a comment, because I want you to shout and challenge him, because I think Andrew just enjoys a little bit of a wrestle and challenge. So I love to hear your thoughts and keep the conversation going with your comments. So to kind of like, while I'm waiting for you to pop your questions in the chat, I'm just going to kickstart the first question, Andrew. You know, from football clubs and tourism boards to pharma, can you tell us a little bit more about this unusual journey you took?
Yeah, there's a lot from non-pharma that I think is really relevant in pharma. I was working, I guess I grew up where certainly digital was very much seen as a tactic, and there was a lot of one message for all marketing going on in non-pharma. So your example was where I first started seeing the power of segmentation and understanding the audiences. So for Visit Britain, we would send out marketing messages across Europe and across America, trying to drive people to this amazing place that we live. And it was only when we started trying to understand, well, what motivates a French person to come to the United Kingdom is vastly different to what motivates someone from Japan. So why aren't we sending different marketing messages to these different people? And I know it sounds obvious now to do that, but yeah, we'd be sending messages to people on our on our database from France, around coming to Britain for our wonderful cuisine, which is laughable to send to the French, and they found it laughable. And whilst the Japanese, they loved coming for things like the Beatles story. They loved coming to experience the Lake District. They loved the golf that you can play in Kent. So there was so much more that we could look at when it came to really starting to understand our audience types. And the same with football, where we would engage with a 14-year-old boy in the same way that we'd engage a 35-year-old man. And of course, what that allowed us, the failure with that is they have vastly different journeys that they're on with that football club. So there was a big drop off, which was really interesting when I started moving into pharma with 14-year-olds, because they started becoming quite independent of the parents who were taking them to football. So from sort of 8 to 13 onwards, children were dragged along to the football, and they were happy because they followed their father. When, especially boys, when they were 14, they'd start discovering girls, drinking, hanging out with the mates. So they didn't want to go to the football with the dad. So we had to market to them differently. So instead of using the mascot, Stamford the Lion for Chelsea or Gunnosaurus for Arsenal, which would be incredibly patronising to a 14-year-old boy, we started using who they would be looking up to, which was the John Terrys and Frank Lampards of the world. And so using the players to encourage these people to stay loyal. And the biggest aspiration for any marketeer in football is what we call cradle to grave, which is where you're constantly engaging in a relevant way with a supporter from when they're young to when they become a member, to when they buy a season ticket, to when they start owning businesses. So we want to push hospitality to them, and then we want them to buy a box, and then we want them to buy tickets for their family. And there was a real customer journey laid out. So when Pharma came knocking, they said, and by the way, I was absolutely opposed to joining Pharma because I just simply didn't think I'd be good enough to work in such a specialized industry. So when Pharma did come knocking and they said, we want to start utilizing all of the aspects of non-pharma that you've been doing in football and tourism into pharma, that was hugely exciting for me. And every job I've had in pharma, whether it was agency side or AstraZeneca side, I've been so fortunate to have a boss who totally backed me and said, take risks, fail, push the boundaries, challenge what we're doing, and do it in a way that brings everyone on the journey. Because I think the worst people in pharma are the ones who kick doors in or who position themselves as some sort of superstar and make out that everyone else are sort of village idiots because they're not doing their way. Certainly, I was very humbled to work in pharma. I felt very fortunate to work in pharma, and very quickly I realised I was surrounded by incredibly talented people. And all I did was just try and bring my nuggets of insights or knowledge in supporting them in what they were doing, rather than some of these people who say that disruption should evolve them. That I never ever position myself as a disruptor. I position myself as someone who could work with a company who wanted to disrupt the way that they were engaging, but disruption for the better. Otherwise, what's the point of doing it if you're not improving what you're doing?
Yeah, I think there's so many nuggets there. First of all, I just want to say I love how you are raw and real. You're so humble that openly sharing your own feeling of imposter syndrome coming to pharma, but also what you shared about, the cradle to grave and, trying to get into the head of a 14-year-old, what will motivate them to go to football versus hanging around girls or drinking with their friends. That's so fascinating. And thank you for sharing that. I just want to bring the audience here because a couple of comments here is, first of all, Jonathan thinks it's really great that you're saying there's no shame in being proud of your product. Sometimes there's a notion that being fair, balanced means not being appropriately promotional. I've got a few questions here. I don't know exactly who that is. It could be Denise, because sometimes Denise comes as a LinkedIn user. The question is, how did you facilitate marketing and sales to become best friends in AZ or work towards that relationship in pharma? And then I've got another question from Jonathan saying, how do you think pharma marketing practices in omnichannel engagement that are different than what is happening in the US market, and how much are cultural norms shaping this? I just thought I'd kick you off with some of the questions from the audience. I think we've got more coming, but do you want to comment on those, please?
Yeah, I think the question around facilitating market and sales to become best of friends, I think one of my colleagues who I'm really proud of has gone to Novo to work with them, a chap called Matt Moore. He was absolutely essential in understanding the frustrations of what the sales team had. So when I joined AstraZeneca, omnichannel was being positioned as the greatest thing since sliced bread, and it was being delivered by massive consultancies charging us millions of pounds, and it was unimplementable, unusable, intimidating, pointless waste of money, I thought. And the sales team hated it because it was being positioned as almost a replacement for them. The marketeers hated it because it was impossible to use. And the digital team hated it because they knew it didn't make any sense. So the first thing that we did was work with the sales team to, first of all, reassure them that what our role was in the omnichannel team or the customer engagement team was to support the great work that they were doing, not replace it. And I was really surprised to say that they were the first people that we spoke to in that way. And I guess, Mehrnaz, so I would never say I'm humble. I'm sure there's a lot of people who say I'm not, but that was the first time I realized that we could make a real big difference, because I was so surprised that other people were, whether it was through insecurity or their desire to make themselves better than they were trying to position omnichannel as a replacement for the sales team, and that it was the answer to everything, but it wasn't, and I don't think it is. So yeah, we worked with the sales guys to show them how we could perhaps populate the top of the sales funnel that would warm up the leads for them or encourage their customers to become more loyal towards AstraZeneca, or prompt them into understanding what their customers were doing on our websites, or whether they were opening our emails. So we were seen then as partners to sales rather than like the big bad wolves of sales. So that's what we did. And I'm still really proud that some of my best friends at AstraZeneca are the sales guys. They allowed me to go out with them. I found it fascinating, as someone who didn't grow up as a rep, to spend time with the field force in understanding that, we went on a brilliant day in Manchester where we met 5 different customers. 2 just simply weren't interested in speaking to us. 1 was absolutely thrilled with AstraZeneca and everything that we were doing in respiratory, was a huge loyalist. One of them was really open and honest with me and just said, don't waste your time sending me emails. Don't waste your time sending me videos. I wake up at 8 o'clock in the morning. I want to spend time with my kids. So don't believe this like bullshit around doctors wake up in the morning and go straight onto the BMJ website, because they don't. They work their asses off the entire day. They've got no spare time whatsoever to read our fancy emails. And when they finish work, the last thing they want to do is read about AstraZeneca's safety and efficacy data. So they said, text us, send us information on WhatsApp. Now, compliance might have had a few words to say about that, but who cares, right? Like, the fact of the matter is that we're delivering content to the doctors in the way that they wanted it. And that really opened my eyes into how we needed to be empathetic to these people. Why waste money on £250,000 worth of emails when our customers are literally saying to us, we're not going to read them?
Yeah.
So yeah, I think that was really interesting, that.
And Andrew, I always think the best marketeers are the one who get out in the field and put the toe in the water to find out what is real, because customers are not shy. They're going to tell us what they like and what they don't like and what annoys them. And I think for me, marketing is like being a weather forecaster. If you're sitting in the studio and forecasting weather, you're not going to get it right. You need to open the window and stick your head out.
Yeah.
So I think marketeers who are really good are spending time in the field and just get the real feedback, not the filtered feedback, like what's really happening. So good on you for doing that. And I think if you stay in the office for too long, within 6 months, without having any contact in the field, you're out of date. You need to make that a habit to keep going out and getting the raw and real feedback, because everything is evolving. The HCP's preferences are evolving, and the pressure on them is huge. In some countries more than the other in terms of time they've got to spend with patients, like in the UK. The waiting times and shortage of staff is absolutely crippling for the healthcare professionals. So we need to empathize with the pain point.
Totally agree. And even like Jonathan's put about, imagine that, asking a customer what they value. Some of the best campaigns, Jonathan, that I delivered at AstraZeneca came from the insights that we got by speaking to HCPs. And I know if any of my non-pharma customers could see how little we speak to our actual target audience, I think that's something we should all be working on. Speak to these doctors, understand what they want to get from us, because absolutely pharma content is essential for HCPs to do their job. We produce amazing content. I'm really proud of the content AstraZeneca produces, because it empowers doctors to make the right decision for their patients. But the way we give it them, that's where I think we really need to look at it, and not trying to tell the entire story on an email, or trying to give a poor rep an e-detail aid and saying go out there and tell the entire brand narrative in a quick 10-minute session. Let's grab their attention, let's prompt their interest, let's stimulate their desire, let's do exactly what McDonald's do to me to make me buy a Big Mac, or what Versace do to Mehrnaz to buy her expensive suits. I think that's what a big learning I think that we can do.
Yeah, I think doctors are humans. We shouldn't forget that. And humans connect with humans, and they see a huge role in field teams creating that connection between the brand and the company. Because, they say, it was a cardiologist said to me, when you send doctors digital contents, it doesn't have the context. As a representative knows the context, so they can always tailor the message based on that doctor's preferences and needs. But I've got a couple of comments here I want to share. First of all, Gavin seems to love you, Andrew. I guess he's from AZ sales team. He agrees with me that you're very humble and you're a great asset for stepping out and spending time in the field. And he says, he likes you, a great example in football, even if Tottenham wasn't his team. I know that's the team you support, Andrew, right? But
yeah, Gavin, Tottenham's my team. I just happen to work for Arsenal, so talk about selling your soul.
So Gavin, who do you support? Put in the chat. I'm curious to know, because I was saying to Andrew, I went to see a game in Manchester that Tottenham probably was the best game they had this season, that totally demolished Man City 4-0. So I think that was their best game, right, Andrew?
It was one of the few games where it was nice being a Tottenham fan.
My husband was because he supports Man City, so that was cool. And I think there was another question we missed out. So let me just scroll up. There was a question earlier on from Mark. Yeah, thanks, Giles, our producers. So hot off the press, he knows what I'm thinking. So Mark asked, how would you compare the digital maturity of pharma compared to FMCG, or the companies you work for, or the companies you work with, and any ideas what would be the biggest challenge to overcome to close the gap?
Yeah, it's a brilliant question, Mark, and I would say digital experiences is where we need to really improve things in pharma, because I think we're quite lazy in that we just create these websites, chuck a load of content on there, and hope that the doctors will visit it. I think where we can learn from non-pharma is taking learnings from sites that personalize the experience based on their knowledge of the customer. So I was massively inspired when I went to go see the director of customer engagement at Netflix, who basically said there's not a single human being on earth who's got the same Netflix experience as another human being on earth. Now, it's quite an ambitious aim for pharma to do, but what I think we should do is try and give content that our HCPs want. And I think the elephant in the room is that HCPs want medical content, not promotional content. So we should start addressing that fact. And I think the second thing is that in pharma, we have the absolute Rolls Royce of technology, whether it's Adobe Experience Manager or Sitecore or Sitefinity. And yet these wonderful enterprise CMSs that are perfect for personalization, we don't use them. So we use our websites. We may as well build our websites on WordPress because we don't use all the functionality that we can do, but we should be, because our CRM systems are the strongest CRM systems. We understand the prescribing behaviors of our doctors. We understand where they are. We understand what guidelines that we've got in those areas. We understand what influencers are prominent in their area. So we could produce an incredible digital experience for our doctors that would make them see our websites as an absolute cornerstone of wonderful content, rather than what I think, well, I know a lot of HCPs think, which is it's just promotional content. So that's why the trust factor goes down. That's why they think it's just biased content from one pharma company. Doctors aren't stupid. They know that AstraZeneca is only going to put AstraZeneca relevant information on there. We're never going to be truly patient-centric, where we'll talk about our competitors in the same way that we talk about ourselves, nor should we. We're not. AZ isn't a philanthropic organisation whose job is to represent AstraZeneca well. So I think digitally we can really start learning how to engage with our customers in that personalised way that non-pharma does. And I don't think it's a big stretch. I think the content exists. I think the data on our customers exists. I think the technology exists. And certainly some of the amazing people I've met at congresses, we've got the people and the talent that can deliver all of this aspect. So it's just a desire to really say, let's change things around. Carolina, I know at Grunenthal, you guys were really pushing the boundaries in how we deliver digital experiences to customers. So maybe we need more people pushing why digital should be a brilliant way of delivering individual personalized experiences.
I think digital has so much scope, but it has to be really relevant. I think sometimes in pharma, we're fascinated about our own products and we talk about the products, but the HCPs are looking for solution for the problems the patients are having. So I agree, medical information is important, but not just throwing like the BNF at them. It's just giving them bite-sized information in the format that they prefer. And I think maybe the problem in pharma is they go to these big strategy companies that they sell them all these big packages, and they're buying it without really validating whether this is what the HCPs want. I think sometimes less is more, but make that content really relevant to what they want and blend it with the interaction, the human interactions. Sometimes it's easier to tell a simple message or a simple story that directly addresses their pain point rather than chucking the kitchen sink at it and hoping something will stick.
Yeah, maybe having a thought of what can we do for you today is more relevant than here's everything we could ever give you ever, and good luck finding what you want to find in there. I think that more bite-sized, a doctor might be after information. They might be after data one day. They might be after the impact on a patient the next day. They might be after a patient story the day after that. They might be after value proposition the day after that. But if we can give them that information quickly, efficiently, and not making them read through piles of crap that they don't want to read just to get to what they want, that I think would be a great start for us to do.
Yeah. And picking up on your example of McDonald's, you don't find McDonald's everywhere. You find McDonald's where there's a footfall of people that they're passing by. And I think some of the marketing, like pharma company website, are placed putting information where no one would go, because the doctor doesn't think, I've got to go to AstraZeneca's website to find information about their product. They go to the general areas where to find information, not like individual company websites. So I think we have to really, in the same way that you thought about what a 14-year-old is curious about, he's interested in girls and he's interested in maybe drinking with his friends, and how you can actually position and communicate something about Arsenal team that would entice him to follow the players. We have to really get into the minds of the doctors to find out what is it that they want and make it so easy for them to find it, rather than just making it convoluted, as trying to feed them, putting a sandwich across your head before you can reach the mouth. So
there's a real arrogance in pharma of, if we build it, they'll come. And the number of castles in deserts I've seen created where we spend hundreds of thousands of pounds on an asset with the false impression that because pharma has built it, doctors will come to it. But doctors are getting their information from lots of other resources, and it's so much easier to join a conversation and add value to that conversation rather than be arrogant enough to start your own conversation. And too often I see pharma shouting at an empty room.
Yeah, I remember I read a book a few years ago. It was called Don't Make Me Think. It was by Steve Krog, and it was saying in digital, you have to make the information so intuitive that people can just get it immediately rather than just click, 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 click to get to it. But we've got a couple of really cool questions here. First of all, Gavin, thanks for sharing with me you supporting Tottenham. I don't know whether it's easy to be a Tottenham supporter this season or not, but thank you for your transparency. My son is a Tottenham supporter, and often he cries after the games, not literally, but quite sad about the result. But as I was saying to Andrew, I saw one of the best games this season. Gavin says, what was the most effective, satisfying program solution you have delivered in AZ? So do you want to kick off with that question, Andrew?
Yeah, I think anyone who's heard me talk before is probably sick and tired of this story. So apologies if you have before, but one of the best projects I ever worked on, Gavin, allowed me to sort of furrow a path with using creativity. So when I first joined AstraZeneca, it was just as COVID was coming to an end, and there was massive vaccine fatigue. Now, one of our biggest brands is obviously flu. Yeah, we need the British people to be having their flu vaccines. And there was a big drop off in certain areas around the United Kingdom, where certainly where I'm from, Scousers will not accept a message from Boris Johnson. Also in Manchester, also in parts of North London. So a lot of the message around get your flu vaccine simply wasn't landing. So we created a completely non-pharma advert that was basically a girl sneezing on a load of kids in a cinema, just to show the impact that flu could then have on people. Compliance were hugely involved in that decision. They helped me get it pushed through. It increased the number of vaccines in those areas from between 12.9% in one area up to 19% in another area. And it proved that creative, attention-grabbing, provocative marketing campaigns do work in pharma. I was then tasked with, all right, you've done it now to the public. How can you do that to healthcare professionals? And it really turned the marketeers within AstraZeneca into people thinking, we can do exciting work here. We can do work that people are proud of. We can do work that makes people laugh or cry. And we worked with some of the best agencies in the world to deliver that work. And I'm so proud of the awards that those campaigns won. AstraZeneca winning a Cannes Lion would have been unheard of before. But now everybody wants to do those types of campaign, not because they're cool to do, but because they saw the impact that it could possibly have. So that was satisfying for me, Gavin, because it was a real change moment for AstraZeneca, where they could see the power of creativity, which works incredibly well in our lives, how we get motivated and prompted and nudged into doing what advertisers want is exactly what we did with AstraZeneca.
That's a brilliant example. And I think a couple of things I really loved about those campaigns. First of all, the creative company who created those, they swept the floor a couple of weeks ago at the PM Society. I think they won 8 different category awards. But a couple of things I loved about that was the way you worked with compliance. You wanted to do something disruptive, and you brought the compliance at the beginning of that discussion, and they were the enablers rather than thinking the computer says no. They worked with you to figure out how they can say yes. I thought that was really, really innovative. So you brought the key stakeholders into the game early rather than going and develop the concept and then sharing with them at the end. And the other thing was you got under.
Sorry, I was going to say about the compliance and legal teams is I think they are the most undervalued, under-respected group of people in pharma. They don't want to say no. Of course, if you go to them 2 days before a campaign goes live and it's the first time they're ever going to see it, then of course they've got to say no. So I wanted to involve them in the storyboarding. They went on the video shoots. Their opinions were hugely valued and valid. And now they're as core a part of the creative process as my team were, as the brand teams were. And they're as proud of some of the work that we've delivered as anyone, and quite rightly they should be. They should be getting the awards as much as other people getting all the glory.
Definitely. And I think the other thing I've loved about your video ad was, you showed what is not visible. That, like when somebody sneezed, you could just see all the debris like landing on people's bodies and faces, and it was quite disgusting. But that makes you think, you feel an emotion that drives you to take action. And I think for me, good marketing is when it makes you feel something, that you can't just stay still and do what you've always done. You have to shift your behavior. And that was really well executed. So good on you for doing that as a team. I've got a question here from Jonathan. I'm just going to bring it up. So Jonathan's asking, what's your feeling about the essential nature of big data? Let me say it in American way, big data. To form an omnichannel strategy and the creepy factor of companies knowing too much about their customers. Thanks for asking that question, Jonathan.
It's a really interesting question, Jonathan. And I'd probably say, I think it's only creepy when people use it in an intrusive, inappropriate way. So, for example, does anyone think the way that Amazon upsells us when we visit their website creepy? When you go on and it says, we know you bought these Versace sunglasses, these Tommy Hilfiger jeans will go well with that. Does anyone think that's creepy, or do people think that's actually incredibly helpful? Does anyone think it's creepy when you go onto Sainsbury's website and they welcome you back and give you your points based on past purchases? Does anyone think it's creepy when Netflix recommend The West Wing to you because you watched Handmaid's Tale? They're all brilliant ways of utilizing data to give a great personalized experience to people. And I don't think any of us think that's creepy. Where I think it's creepy is if I imagine, Jonathan, if I was a doctor and I got an email and it said, thanks very much for visiting the AstraZeneca website. You looked at pages 7, 9, and 12, and then you disappeared. Yeah. But what's the point of that? Like, what's the point of just telling someone that you understand things about them? Why not use the fact that we're fortunate enough to have that data on people and give them an experience that they want? So I think creepy factor is only when it's misused. And that's the job of marketeers, to ensure that we're not misusing the fact that we're fortunate enough to understand things about our customers, and we present to them content that's relevant to them, and then they'll be grateful to us and they'll be happy signing up, and our consent rates will increase, and people will be prepared to give us their email addresses because they know we're not going to spam them with a load of crappy emails. We're going to give them content that's useful for them to do their jobs.
Yeah, definitely. This is a really, really good discussion. And I love the questions we're getting from the audience. It makes it so much exciting because, as I said, what's the point of having a live event and not have audience participation? I've got a great question from Carol. She says, what's the most exciting marketing trends you're seeing this year? And I guess this gives you an opportunity, Andrew, to share what are the trends you're seeing that needs to be there as well.
Yeah, I think I definitely think things like webinars are hugely on the up. There's some fantastic products out there. I know at AstraZeneca, we absolutely transformed the way we engage with our customers digitally through the SpotMe platform. I think that's a trend, and I know it's not as cool as AI or personalization of content. But what I love about the way that we're increasing our ability to use webinars to engage with customers is it's how doctors want to engage with us. I don't think they're going to be attending congresses as much. I certainly don't think they want reps visiting them as much. It can give them content that they need, that they can sign up for, that's relevant to them, and they can access it either in real time or on demand. But the beauty of it, of what that webinar strategy is, Mehrnaz, is the fact that we can engage with these customers with relevant content before the webinar, during the webinar, and after the webinar. And if you're talking about omni-channel, which I hate talking about, you can have a micro omni-channel journey through that entire webinar platform, and it can drive different people to different areas. So some people who've expressed an interest in a certain topic that was going on in the webinar, they might be pushed to an area of the website with relevant content on there. Another group of people might be prompted to request an MSL visit, because we can make decisions based on real-time engagement with that. So I think I'm seeing a lot more budgets, quite rightly, being shifted over to webinar. I'm seeing the brand teams and the external engagement teams massively up in their game from just having what was a physical meeting being dumped online into really starting to understand what makes a good digital experience. Taking people out into breakout rooms, giving people the ability to comment, or utilizing some of the functionality within SpotMe to show their pleasure, their agreement, their displeasure. I don't think there's anything more powerful than seeing 300 HCPs listening to a speaker who's enthralling and giving them great content that's relevant to them, and seeing their reactions to that. And to follow on the next trend, I think that is also appropriate to the speakers is, I think, peer-to-peer content is by a country mile the best type of content we can make most of. There's nothing I can ever produce in pharma that is going to be as strong as another doctor talking about our products in a positive way. So identifying these key opinion leaders, these digital opinion leaders, there's some brilliant companies out there who can support pharma companies in identifying these people, getting them to speak, and utilizing that content. And again, that arrogance of, well, we better produce it because we're the pharma companies. Why? There's people better out there talking about our products that we should be engaging with. So sorry, it's not an AI. Sorry, it's not an answer about AI.
No, I totally agree with you. I think the best content is the content created by HCPs themselves and delivered from peers to peers, because it's real. It's based on real examples. So no, I think what you said in terms of when we go to conferences, it's not the speakers that matters. It's the chat that happens in the coffee between people. Most of the learning happens then, not in a formal session. So two big trends you shared. Thank you for that. Andrew, I'm conscious of time. This has been so cool. You've been an amazing guest because you've done a great job of engaging the audience and bringing them into the conversation. I really thank you for that. I just want to kind of wrap up by just, ask your opinion about something. I know you were one of the first people to read the Omni Advantage, and you shared your feedback with me, which I really appreciate. But I was just curious to know, because I think, my motivation about writing the book was just to keep it raw and real. And the first 5 chapters are like highlighted what we're doing wrong in pharma. And in the next 5 chapters, like shifted about what we should do to really meaningfully engage with HCPs. I was just curious to know, like, this is your chance to give your honest, raw feedback. Was there anything that resonated with you, or anything that you think you disagreed with, or any favorite chapters that you want to share?
Yeah, you slightly stole my thunder in that I think, and this isn't a criticism of your first 5 chapters, I think it's very easy for people in pharma to highlight what's wrong, what we're doing wrong. And it frustrates me when that's all people do, because anyone can say our omni-channel strategies aren't great, our content is a bit boring compared to other content. What are the answers? What are the solutions? And that's what I loved about your book, is it lays itself bare. People might challenge it, people might disagree, people might I know for a fact people disagree with some of the stuff I say, but at least we're putting our head above the parapet and being brave enough to say, well, this is my opinion. I'm not saying everyone should follow it. We're not trying to create a cult, but at least your book was, here's the solutions to some of the problems. Use those solutions, try them. They might not work. Just because it works for GSK might not work for Merck, but try something new. Don't just sit there with your head in the sand, collecting your massive salary and your big bonus and complain about the wonderful industry we're in. We're in the best industry in the world. I've worked in non-pharma and I've worked in pharma, and I'll always choose pharma. It's an amazing industry to work in, and we're paid well. We're paid very well, and we should be brave enough to make decisions without being fearful of it not working. Otherwise, get rid of all of these expensive people and just bring in a load of project deliverers and let pharma save a whole load of money. But we need agents for change, and we need those people to be highlighting solutions, not problems. And that's what I loved about your book. And that's what I love about a lot of people I speak to in pharma. They're very solutions focused now. And these naysayers who just moaned about pharma needing disruption, they're gone. Their loud voices are now ignored. And I love the fact that we're a very positive industry, in that we want to change, and we are changing, and we're doing wonderful things.
Thank you, Andrew. I really, really appreciate it. I think I feel really privileged to work in pharma. I used to be a healthcare professional, and when I worked in the hospital, I would probably care for 28 patients. But I think when I joined pharma industry back in 1992, people were saying to me, like, do you not miss being at the patient, interface? I was saying, I'm not at the patient interface, but I'm talking to doctors who can change lives of thousands and hundreds of thousands of people. I'm making an impact in a different way, and I still feel so passionate, because we have the opportunity to create access to medicines, help patients, have access to novel treatments. So I think if you do a really good job, we can have a really big impact in creating a healthier world. And the reason I wrote the book was because I was tired of seeing pharma just communicate, just push messages without truly connecting. And for me, connection is much more than just communication. It's about really fully engaging and focusing on the other person, not talking about us and our products. Is about really understanding their pain point and having messages that like addresses their pain point. So I think for me is, joining pharma was extension of what I was doing as a healthcare professional, but on like a bigger scale. And I feel really passionate about our industry. Andrew, it's been so incredible having you here today. I wish I could spend another hour asking you, because maybe I should invite you back, because you're a mountain of knowledge, and I love your humble, real way that you share your expertise. And I'm sure our listeners really enjoyed hearing your insight. So really thank you for making time and joining us today. It's been amazing.
Thanks for having me, and thanks everyone for your comments and questions.
And also want to thank everybody who joined us today live. Thank you for being part of this conversation. Honestly, your comments, your questions were being really cool, and it allowed Andrew to kind of expand and share his insights. So thank you for prioritizing, taking an hour of your day and joining us. And, I feel really, really humbled for us joining us. And at the end of the day, I think we keep talking about digital transformation and omni-channel, all these buzzwords, but at the end of the day, this is not about the channel. This is about having meaningful connections and engagement with healthcare professionals and helping them so they can help their patients. And for me, engagement is not about coverage and frequency. It's about really listening. It's about understanding them in the same way that Andrew explained about getting into their minds and really adding value to them, because that's how we can become their trusted advisors. And I honestly believe that within us, collectively, we have the power to do something so much bigger than the sum of our individual efforts. And by breaking down the silos, really creating that human connection and investing in our growth, we can really unlock our potential to create a healthier world. So thank you, Andrew. Thank you, everyone. And can't wait to welcome you to our next session next month with Elisa.